Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students or nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos twice a week. Please make sure to subscribe now. You hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help I know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody! Isang panibagong Monday nga. Monday na naman ito sa week na ito. And you know when it's Monday, it's another class. It's another topic. And today I'm bringing you nursing drug study. And like you're seeing on your screens, today is all about this drug right here. Propofol. Now, this is another concept natin sa ating critical care nursing. Definitely, this is one of the medications that we give in the area. So, if you are not familiar with this medication, well, let this be the end of that not knowing this medication, because at the end of this topic, at the end of this video, I am going to make sure to you that you'll be able to understand this medication to the T. Why? Because I'm going to give you the drug class, mechanism of action, indication, contraindication, adverse reaction, and this will not be a nursing drug study if we will not talk about your nursing interventions. So basically, I just wrap it up to you the chapters or the objectives for our today's discussion. Now, maisingit ko lang, kung hindi mo pa napapanood yung very latest upload ko regarding sa CVC, central venous catheter, where I discussed to you the types of central line that we normally have in the area and we do in the area. Please make sure to check the one out. I put it on the featured video for my channel, and yeah, check the one out. And I'm planning to upload like a nursing test banking video probably by Thursday or Wednesday, para makatulong ako doon sa mga upcoming test takers natin ngayong May. May na nga ba? Anong araw ba yung nursing board exam? Paki-comment nga sa comment section sa baba, okay? Now, ipupush ko lang ng very light itong discussion natin about sa Propofol. I've done a lot of nursing drug study, nursing pharmacological contents I have on my channel, and that's all for you for free. Check the one out. I'll be putting the link on the description box, and whenever the icon button pops out, click the one out because I'll be putting it there together with the other playlists I have on my channel. So let's jump right into it. Yes, we're gonna start with Propofol, and we're going to discuss your nursing drug study. So what is Propofol? So you guys, Propofol, in terms of drug class, this is a sedative hypnotic agent. This is one of the common sedatives that we give in the area. In my facility, there's actually 3 sedatives that we give to our patients who are intubated. There's fentanyl, midazolam, and propofol. So I believe I have a lecture about fentanyl and midazolam. If you haven't watched that, click the one out, check it. It's in the nursing pharmacology playlist. So like those two, this is a sedative hypnotic agent. This is normally given to patients who are, like I said, intubation, or if they're gonna do an OR procedure. This is one of the medication we use for induction of anesthesia. Hence, I'm gonna discuss to you ang article sa the mechanism of action. How does this medication works? Now, you know that from the drug class, it's pretty self-explanatory. You kind of like have an idea that the organ or the system of the body that this target is what? Your nervous system, and primarily your CNS, central nervous system, which consists of your brain and your spinal cord. Now let's discuss further. Now, in terms of mechanism of action, the action of Propofol involves a positive modulation of the inhibitory function of the neurotransmitter gamma aminobutyric acid, or what we call GABA, through a GABA A receptors. So if you kind of like remember how a neurotransmitter and neuroreceptor works, this is where how your propofol function. So it binds or it inhibits the function of our neurotransmitter, which is your GABA, through GABA A receptors. So by blocking the neurotransmitter, which is your GABA, you will inhibit the GABA A receptors. Okay, so going further, now we're gonna talk about the reabsorption, but still we're reabsorption or the absorption of this medication and how rapid it is when how rapid it acts to the patient's body. But we're still in the mechanism of action. Now, it is quite rapid. Time to onset of unconsciousness is about, listen to this, 15 to 30 seconds due to rapid distribution from plasma to the CNS. Distribution is so rapid that peak plasma concentrations cannot be readily measured. Duration of action is 5 to 10 minutes. So as you can see, it is really fast. If you want to knock the patient off, this is the right medication for you. Okay, now, maidagdag ko lang, Propofol is normally called the milk of sleep. Because if you haven't seen a propofol in real life, it looks like milk. It's in an ampule, and you have to open the ampule and aspirate it. I'm gonna talk to you walk you through in terms of the preparation of propofol later on in this topic. So we're basically done with the drug class and mechanism of action. Now we are moving towards your indication. So to which patient are you expecting this medication to be administered? That is the question that we're gonna be answering today. So, indication, I list down 4 here. So, first one, we have here your induction of anesthesia therapy. So, what did I tell you? If patients who are going to be in the OR, before they give the propofol is actually used as anesthetic, induction of anesthesia for anesthesia purposes because of its rapid response. Next, maintenance of anesthesia therapy. In terms of anesthesia and induction of anesthesia, propofol is being used again because of its mechanism of action and because it's really quite. If you want like a rapid sedative / hypnotic agent to your patient, propofol is the drug of choice. Next, we have here to monitor anesthesia care sedation. And we have sedative therapy. It's basically widely used in the ICU because it's safe. And although there's some adverse reaction to propofol and adverse danger signs or danger warning signs whenever you give propofol, those are the things that you need to watch out for. We're going to tackle that later on. But propofol is widely used in the ICU as a sedative therapy. If you want to sedate your patient for the indication of intubation or severely combative patient, those kind of things, you can expect that the doctor will order propofol to start with. And as a sedative therapy, maisingit ko lang, we have to also take note that we measure the efficacy of your propofol by following what tool are we using? We're using RASS score. Any one of you familiar of RASS? RASS is Richmond Agitation Sedation Scale, and normally the doctor will set a target RASS score for your patient. I believe when I discuss about ICU drip sedation, I discuss this to you guys, so check that one out. But normally the target RASS score is 0 to -1, slightly sedated patient. Okay, but it depends on the indication for the patient and what is the physician's physician's recommendation. Maisingit ko lang, propofol is also given. One of the indication is when you want to give propofol to patient when there's like a bedside procedure. For example, you're gonna intubate the patient. It depends on the preference of the physician what type of sedative that they're going to use during the procedure, such as intubation, central line insertion, intubation, upper endoscopy, lower endoscopy, or bronchoscopy, those kind of stuff. It depends on what is their preference, a drug of choice when it comes to sedatives. But most of the physicians that I encounter, it's either propofol, fentanyl, or midazolam. So yes, it's given as a sedative because you don't want to really like cut the patient or intubate the patient while he or she is awake. Not good. You don't want the patient to remember such thing to him. Okay, so those kind of stuff. So we're done with the indication. We are moving towards your indication. Indication, contraindications. I'm sorry. So earlier we discussed to whom are you gonna give propofol, and we answered that, and now we're gonna answer the question: who are those patients that is not indicated, or propofol is being contraindicated to them? All right, so I list down here 4. One, we have here your hypersensitivity to propofol, which contain, listen, soybean, oil, egg, or eggy, sorry, typographical error, egg products, dairy products, oil and soybean. So propofol is actually made of these products. So any hypersensitivity, any allergy to these products, is you have to make sure that you check the one out and you do a thorough assessment, so that you know if there's any allergy to this medication. If in the event that the patient have, let's say, allergy to egg or soybean, you want to tell your provider, and if the provider feels and thinks based from his judgment or that it outweighs the benefit, then you have to watch out for any adverse reaction towards it, because considering that the patient is already having hypersensitivity to a medication which you are about to give to him, you can expect adverse reaction. We can talk about which we will talk about in a bit. Now, what are the other contraindications? We have here obstetrical procedures. OB procedures, hindi po siya binibigay because it can cross the placenta. Also, we're talking about the placenta. You're also not going to give it to nursing mothers. Those mothers who are breastfeeding, do not. Gusto mong malasing or ma-sedate din yung baby? Ayaw mo nun, huwag kang ano dyan, okay? So nursing mother and any obstetrical procedures. And lastly, you're not gonna give it to patients who are pediatric patients who are less than 3 years old. So these are the contraindications of propofol. Now that you know, I'm gonna give you time to just like subscribe, hit the notification bell before I further proceed with your adverse reaction. Show me some love, you guys. Come on. Thank you so much for doing that. You are amazing. All right, so we're going to proceed with your adverse reaction. So adverse reaction is different from side effects. I kind of like discuss that to you. Again, adverse reaction is the reaction or the signs and symptoms that will tell you that this patient is having is having, how do you say, unexpected, or negative response to the medication. All right, because adverse side effects is expected outcomes. Adverse reaction, those are the least likely to occur, but when it occurs, that will tell you to stop the medication because the patient is not responding very well. All right, so I list down few here and we're gonna go through it one by one. One is paresthesia. Yes, paresthesias, including burning, tingling, stinging, and or pruritus, usually manifested in the perineal region, were the most frequently recorded adverse reactions in clinical trials, because they kind of like did a clinical trials before releasing this medication, and they found out this adverse reaction, paresthesia, specifically in the perineal region. Next, we have blood clots. Blood clotting is one of the adverse reaction of propofol. Take note of that. That's why some doctors, they might run coagulation profile. All right. Seizures. Now, seizures is the adverse effect of this medication, Propofol, and it's normally related to rapid administration. So you want to make sure that you do slow IV push. Which I believe we're gonna discuss that later on. Next, cardiac arrest. Most of the patients who are taking sedative, they're normally attached, especially in the ICU, they're normally attached in the cardiac monitor, and you have to watch out for any life-threatening arrhythmias, such as your supraventricular tachycardia, your VFib, your asystole, your VTAC, those kind of stuff, and any arrhythmias to your patients. Next, we have apnea lasting for 30 to 40 seconds. Any patients who are on Propofol, sometimes you will hear the mechanical ventilator alarms or the cardiac monitor will tell you that there's apnea. Patient is on apnea, and it's an adverse reaction towards Propofol. 30 to 40 seconds of apnea. Not bad. You might wanna taper the patient down to Propofol, win him off or win her off to Propofol. Next is hypotension. Yes, hypotension, because it's a CNS depressant, you can expect a decrease in blood pressure, which will indicate you that is an adverse reaction. We also have renal toxicity, because this is being what? This is being metabolized in the kidney. Next, bronchospasm. Bronchospasm, definitely you want to watch out for it, because you want to make sure that the airway is being patent and there's equal bilateral chest rise and fall. All right. So bronchospasm is one of those adverse reactions, together with the other adverse reactions we just had. Now, okay? So, we're done with the adverse reaction. We're moving towards your nursing interventions, ang pinaka-favorite mo. Now, before we further proceed with the nursing actions that you have to be mindful of, let's just have a quick review on how are you going to prepare Propofol. Now, in terms of infusion, so infusion, this is how you're going to do it. One ampule is, I want you to understand that one ampule Propofol is equals to 200 milligram is equals to 20 ml. So one ampule, there is 20 ml of Propofol in there. And that is equivalent to 200 milligram of Propofol. In terms of preparation, normally in our facility, the doctor will order 2,000 milligram of Propofol and to be infused at this rate. Target RAS score, -3, -2, and so on and so forth. Now, in terms of preparation, ano ba nangyari sa PNF ko today? Char. Preparation, 500 milligram is equals to 50 ml without dilution. Now, this is just an example. It really depends on your SOP. Normally, in my SOP, in my facility, what we do is like 2,000 milligram Propofol to be given to the patient. Undiluted po ito. Hindi siya minimix sa normal saline, ha. What we do is we get like a bag of normal saline. If there's no empty bag of normal saline, we will remove the normal saline, empty it, and then we're gonna use that bag to put the 200 milligrams of Propofol. That is equivalent 2,000 milligrams of Propofol. That is equivalent to what? Almost like 100, more than 100 ml of Propofol. All right. So drug concentration 1 ml is to 10 milligram. All right. So in terms of rate of infusion, how are you going to calculate it? Desired dose is times or multiplied by quantity over drug concentration. Example, 10 milligrams times 50 ml, which is your quantity, over 500 milligram, that will result in 1 ml per hour. Now, if you have like an infusion pump in your facility, it's actually easier for you. It makes your life way easier. But you have to put the datas correctly. Now, this is an example on how are you going to set up Propofol in an infusion pump. So you have here 10 milligram of Propofol. Let me erase that quickly. You have here 10 milligrams of propofol every 1 ml. So that is equivalent to 150 milligrams per hour or 15 ml per hour. Does that make sense? Yes. So basically, what you're gonna enter here in this infusion pump is the concentration, which is the 10 milligram, and how many ml is that. All right, so it will result, the infusion pump will automatically give you this values, which you're gonna put it on your nurse's notes, document it, and you will endorse it accordingly. So that's just a quick review on how are you gonna calculate propofol and how you're gonna prepare it. All right, now your first nursing intervention that you have to do, since you know that this medication has an effect on your CNS, of course you have to monitor hourly your level of consciousness, including your GCS. In terms of monitoring your level of consciousness and your Glasgow Coma Scale, you have to base it on your baseline GCS and LOC. So any changes, or baseline RAS, any changes from your baseline, that will indicate you, or that will tell you if you have deteriorating level of consciousness, or if your level of consciousness or the level of the consciousness of the patient is actually getting better. Next, assess for signs of adverse reaction, which we just had earlier. Any adverse reaction should be reported and documented promptly. You have to report it promptly to your physician so that you can address it right away, because as you can see, most of the adverse reactions are really life-threatening, especially your cardiac arrest, seizures, your bronchospasm, hypotension, apnea, those things. Next, administer propofol slowly via IV push. Now, fast administration may cause seizure to the patient, which is one of the adverse reaction. Push it slowly. Huwag kang nagmamadali. Lastly, assess respiration and notify physician immediately if patient exhibits any interruption in respiratory rate or apnea, because again, this is one of the adverse reactions or signs of respiratory depression, including decreased respiratory rate, confusion, bluish color of the skin, and mucous membrane. Yung tinatawag nating cyanosis. Cyanosis is actually a clear indication of hypoxia. And difficulty or labored breathing, yung tinatawag nating dyspnea. Monitor pulse oximeter and perform pulmonary function test to quantify suspected changes in ventilation and respiratory function. Apnea or excessive respiratory depression requires emergency care. All right. So definitely you want to win off patient, or try the soonest you start your propofol. Once the patient stabilizes, you really want to start tapering the patient out from propofol until you successfully removed him out from this type of any type of sedative actually. Okay, you don't want them to be dependent to these medications. Once again, this is all about your propofol, and we just finished our nursing drug study for today. I hope you like our discussion for today, and if you want to get a copy of this, I'm planning to set my page, my YouTube channel into Patreon, and I'm gonna give this to my Patreons. So if you want to get the copy of the exact same lecture that we just had now in PDF, I'll be more than happy to. But you just have to give me time, be patient, because I'm studying how to do it. I don't know actually how to set up an account for Patreon. So if you have any idea though, let me know. I'll be more than happy. And I'm planning to changing the name of the channel. Let me know if that's a good idea, or if you have any name for our channel. Let me know in the comment section below. Once again, dito natatapos ang ating discussion. Thank you very much for watching. I hope you learned something. Help me grow my channel. We're moving towards 25,000 subscribers really, really quick. I'm hoping this year we're gonna hit 50,000. I'm just gonna put it out there. Come on, make it happen. Tulungan nyo lang ako, ipamalitan nyo na sa radyong sila ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. I'll see you again this week for another lecture. Have a good one.